All right, everyone. Well, my clock has noon. So, hello, welcome to the Share My Screen series on advanced content design. For those of you who are new, thank you for joining us. And for those of you who are repeat customers, thank you so much for your continued support. I am Katrina Boylan, Senior Research Writer at the Center for Injury Research and Policy at Nationwide Children's Hospital. And I'm the coordinator for the Center for Injury Research, Translation, and Communication, or CERTSI. We started CERTSI to help bring the skills, the tips, the best practices that we are using every day in our health and science communications to public health professionals, researchers, and really anyone trying to more effectively reach an audience. And so the Share My Screen series came out of what happens at a lot of our meetings, where we literally share our screens with each other to demonstrate a new skill or work collaboratively on a project. So we decided to turn that into outreach and education. So if you missed the first series on design basics, you can find that on our YouTube channel, which is just CERTSI_ if you search for that. And this series will be recorded and posted there as well. So today's topic is using ChatGPT for content creation. And I know there's a ton of interest in this. And so we want to make sure we have time for everything Tracy's going to talk about. So I'll stop here. Tracy is our Director of Research, Translation, and Communication at CIRB, the Center for Injury Research and Policy at Nationwide Children's. And she has long been on the front edge of what is happening in the intersection of research and the larger world of communications. So she is going to walk us through how she is using ChatGPT to help us promote our research and share information with our target audiences. So take it away, Tracy.
Thank you, Katrina. Okay, so I want to set the stage just a little bit. As Katrina mentioned, we've been getting a lot of questions about how we use ChatGPT and have found that live demonstrations of the process that we go through and some of the questions that we ask have been very helpful to people, which is why we're doing this today. For today, I'm actually going to use a real life example that came up recently for us. And I'm going to show some examples of the types of prompts that we used and what we asked it to do that hopefully will be helpful to everyone here. Just setting the stage, we aren't going to be analyzing the results in depth of the presentation. So I wanted to note that we never use anything exactly how it comes out of ChatGPT. We use it more of a tool to help us get started and brainstorm and give us ideas. I also want to point out you have to double check everything to make sure that it's accurate before you use it. And you want to make sure that you revise the language to make it your own. So use it for what it is. It can't do everything. It also usually doesn't structure things exactly as we would and leaves some things out. And I'm going to show you what a few examples of how we address that, but just wanted to talk about that. And then finally, I typed out the prompts ahead of time, so you don't have to stay here and watch me type and to save time. So I'm going to be copying and pasting from another document just for transparency. Okay, with that, the examples I'm going to show today are based on something that happened recently at our hospital. One of the nurses in our trauma department realized that we were seeing an increase in lawnmower injuries that were being treated at our hospital. And we wanted to do something to get the word out about how families can prevent these injuries from happening. My role in that was to look at messaging and outreach. And so I wanted to start by going back to a research paper that we had published a few years ago on the topic. So that's where we're going to start today. I'm going to share my screen. And this is what ChatGPT looks like. Now, I am going to be using the paid version, which you can tell up here. It says the 4.0. You can actually change it to different things. So you can use it with the free version. Since we do pay for the paid version, I'm going to use it today because it allows us to do a few more things. And I will say in my personal experience, it is a lot better. So if you can get access, that would be great. And then also down here, I want to point out in small letters under the chat box here, you can see it says Nationwide Children's Workspace chats aren't used to train our model. That means we have a closed system. Our organization has contracted with OpenAI to make sure that what we put in is closed. If you do not have that, please make sure that you do not put in anything that is PHI, anything that hasn't been published or that might be proprietary or confidential. That said, the paper we're using today is already published, so it's out there in the world. So the first thing, like I said, I wanted to do is talk about research that we had already done. So I have a PDF of our paper, and with the paid version, you can just drop the PDF right in here. With the free version, you can't do that. You'll have to copy and paste pieces, but you can like copy the discussion section in there and ask it um, to respond. Okay, so the first thing I wanted to do out of curiosity was have it look at it and say, please summarize the findings of this research. Drop the PDF in, had it summarize, and look, just that fast, it is summarizing for me what the findings are from the research. And it is actually pretty accurate. Again, you need to go back and confirm, but it does a pretty nice job of it. I also wanted to see there's some tables and charts in here, and some people have a harder time reading tables and charts. So I wanted to see what would happen if I asked it more about that. So I pull a table in, and I'm going to ask it, please summarize the findings, the key findings of this table. So if you look at the table, could be a little bit challenging to look at, and there's a lot of data in there, and what does that look like? And so really quickly it starts to put it in a point format that's a little bit easier for me to understand. Now, I wanted to show another cool feature that you can do with that. So there's a lot of information there. So I wanted to look at just maybe the mechanisms of injury. So I asked it, please make a bar chart from the data in point 4. And it can actually make bar charts and different types of charts for you to make it a little easier. All right, it's going to take a little bit longer to do that, but you can see here's information with the bar chart, right? So you can use that and you can interact with it as well. I also wanted to point out, if you've noticed, I asked it, please make a bar chart from the data. It's iterative. You don't have to say to go back to the paper every time. So you can almost use this as like somebody you're having a conversation with. Okay, another option is a chart. And I just wanted to show what it does with this. So you can do the same thing, upload a chart, please summarize the findings, and it will do that for you. Okay, so you can see how quickly it will do that. And that can be helpful maybe if somebody doesn't have the research background to understand what you can and can't say from charts and things like that. Again, you have to take it and really look sure to make sure it's correct, but it does do a nice job with that. Okay, so I wanted to go back now and kind of flip to some health literacy. If I want to go back and look at this paper, but I want to talk to a lay audience, people that aren't researchers, sometimes we think about, reading grade levels. And so I was curious what it would do if I said, explain the findings of this research to me like I was a 10-year-old. So we'd put the prompt in. And you can see it starts to do that, right? But it kind of, what I didn't think about was it talked to me like I was a 10-year-old child. And that might be okay in some instances, but sometimes I want to talk to the parents who have lower reading grade levels, but maybe aren't, the language isn't like talking to an actual child. So then I asked it to explain the findings of the research to me like I was an adult with an 8th grade reading level. So if you are in health literacy, really clear, this does not know how to do any of the different small gradings or any of those different tests that we do. It's not great at that. You can put some languages and it does a better job, but this is more just getting it simplified, not all the way to the highest standards of health literacy, but it will help start getting you there. I also, you can do things like say things like rewrite this, rewrite the answer using fewer complex words, and it will get it a little bit better. But again, this is a start, right? We also wanted to see what it would do in terms of helping us get the information out there to the public. So I asked it to write a press release about the paper. and add a quote from the senior author, who is Dr. Gary Smith from our center. I wanted to make sure that was really clear. And look how quickly it created a press release for us. Now, I wanted to point out one of the key findings in the study. This was over a 25-year period, and there was a significant decline in lawnmower related injuries in this study. But that's not what we wanted to focus on, because for us, we tend to see that if we focus on the decrease, then people think, uh, you know, maybe I don't have to worry about this because the injuries are going down. So we instead like to focus on the fact that the injuries, even if they are going down, are still happening, and here's what you can do about it. So I asked it to rewrite to focus on the number of children that are injured every day on average. And so it does a little bit of a better job of that. This is interesting every time you do it. So I practiced this yesterday and the title was completely different. So that is one thing. You'll get a different answer every time you do this. So sometimes you just have to keep repeating and seeing what you can find, or change the way you're wording the questions a little bit. And it can help get different answers. So you have to interact with it a little bit. It's not perfect every time. We also wanted to see what would happen in terms of social media. So how will it do with getting us social media? So I asked it to write 5 posts for Twitter based on the research. I did use Twitter instead of X, because when I put X, it didn't quite understand how to do that. So I revert back to Twitter when I'm referring to that. But you can see how quickly it starts to put out information. It has emojis. It even recommends some hashtags. So again, great place to start, and could be really helpful with information. I wanted to see then how it would do with Instagram carousels. Can it give me some ideas based on that? And it actually does a pretty nice job. Not only does it give me a suggestion for a cover image for each one, but it gives different ideas. And you can see, like, the first one has different tips. The second one has more about the statistics. The other one has some different ideas as well. So it gave me different ideas, which I think is interesting. Another thing that's really important for us is the actual visuals. So I asked it, create an infographic based on this research. This one's going to take a little bit longer because it's a complicated image. Um, but as you can see, I don't think ChatGPT is quite ready yet for images. There's a whole heck of a lot going on there. It doesn't always get the text right. There's like among childrets. I don't even know what that is, right? So there's you can't really quite use these yet, but what I would say is that you could use them as inspiration potentially. Is there something interesting about how they put this together? Oh, I might want to do that to create it on my own. But they're not quite ready for this type of thing, and even editing it would be pretty hard and things like that. So in terms of that kind of thing, I don't think ChatGPT is quite ready yet. Um, Okay. I also wanted to kind of pivot a little bit and think about um, how else can we get this information out there? And so we got asked to do some talks around our institution and around the area about this topic. So I asked it to act as a public health professional and create 10 catchy titles for a talk for healthcare professionals on how to talk to families with young children about lawnmower safety. And I said that all those words because I want you to see I did a few things differently there. Act as a public health professional is one thing that you can do for a prompt. If you tell it to act as a job, it could be public health professional, it could be marketer, it could be health literacy specialist, whatever your role is, it actually will do a better job in many cases of getting you the information that you are actually looking for. And then if the more specific you are, the better it is in getting you the information. So you can see it gave me some ideas for um, the titles. So then I actually went the next step and said, okay, write a description for a webinar titled one of the titles that it picked for me, or a combination of titles. And then it gave me all of these different things. And then I asked it to, okay, we have to write learning objectives a lot of times. So I asked it to write learning objectives for me. And it did a pretty good job. What I wanted to do, recognize key risk factors, developing communication skills and implementing safety best practices. Not horrible. I wouldn't use it exactly, but it's a really good start, right? I even asked it to write an outline for this 45-minute webinar, and it puts together an outline, and it even tells me time that I would spend on different pieces, which I think is really, does a nice job. Now, one thing that I noticed is that we wanted to focus on advocacy, and there wasn't a lot of advocacy in the original draft. So I talked to it and I said, revise the outline to include a section that focuses on how you can advocate for changes to voluntary standards in lawnmower design. And now it redoes it and it adds a section in there. You'll see. Now, it does not always do a great job when you ask it to add sections of recalculating the time. So you'll have to pay attention to some of that. But you can work with it and get it to update and improve. Another really important piece for us was educational materials. So we had some educational materials at our hospital already, and we started with those, but I wanted to see how it would do with helping me to create some additional educational materials. So I asked it to write a blog post aimed at 12-year-olds who will be learning how to mow the lawn for the first time. So it put together this blog post, Mowing the Lawn Safely, a guide for first timers. And it's actually pretty good. And it wrote it like a blog post, short, succinct, bullet points, things like that. And it does a pretty decent job. It's a great place for us to start. Another area that's really important to us and something that we want to focus on is health disparities and differences in health equity. So I asked it, what are some of the health disparities that exist around teens and lawnmower safety? And it started to come up with a list for us. This is not all inclusive. It will be based on what it's trained on, but it was a really good start, and it gave me a great place to start thinking about what some of the health disparities are. Tiffany, to answer your question, most of this can be done with the free version. You can't upload PDFs, but all of these questions you can ask. Sometimes the answers to the questions might not be quite as good, but you can do all of this with the free version. Also, charts and graphs you might not be able to do that, but you can do some images in the free version, is my understanding. I know I tried the infographic, and it will create an infographic. It's just not a very good one. Okay, so I was really intrigued by this idea of the urban versus rural. That's one thing that we see a lot in our state of Ohio. So I wanted to go a little bit farther with that. So I asked it to act as a health educator and write the text for a one-page flyer designed for 16-year-olds who live in rural locales who will be mowing the lawn using a riding lawnmower. So it started to put that together, and it does a decent job. And has puts it into different places. Sometimes it doesn't always distinguish between push mower and lawnmower, so we might need to do some work there. But it does a nice job with it, and it's a great place to start. In terms of images, this is text, right? So I wanted to see what it could help me with. To come up with it. So first I asked it, give me ideas for photos or images, and it does that in text. So that can help me if your organization has a platform like Canva, or you have access to one of the stock photo sites, or even if you can go to one of the free stock photo sites, you can look for these things specifically, which can be really helpful. But you can also actually have it create some of the images on their own. So I asked it to generate an image of a teen who lives in a rural location of the teenager wearing all the safety recommendations. And I said what those things were. So it comes up with this image, which is pretty decent, actually. And every time you ask it, it will come up with different images so you can see some different things. But you can actually use these images. If you like this, you click on it it zooms it out so you can see it a little bit better. And you can go right here and click save to download, and it downloads it right to your computer, and then you can use that. A newer feature, and this is only available with the paid version, but if you do select, you can actually highlight, like if I want to get rid of this push mower in the background, you can highlight that and say remove push mower. And it will work on the image. I will say this feature is not always perfect, but sometimes it can help you do what you want. In this case, I realized he has two sets of ear protection. Probably doesn't need both of them, so we could get rid of one of those as well. So here, this is a great example. It removed it, but now it put it back in and turned it in a different direction. So sometimes you have to play around with it a little bit, but that editing feature can be nice. You have to work with it a little bit. Okay. I also wanted to see what it could do in terms of hashtags. So I asked it to generate 10 hashtags for an educational campaign for rural teens on lawnmower safety, and it put some together. Some of these might work. You might need to keep asking it. You might need to give it more information, but we did actually use hashtags for a recent campaign that it helped us create. We were struggling to come up with one for a couple of weeks, finally put it in, and it came up with one like that, which is fantastic. Another kind of neat feature is it can actually create tables. So I asked it to create a table of groups that might be affected by this research and what steps they can take to prevent injuries from lawnmowers. So you can see it came up with teens, schools, community organizations, government agencies, retailers, told me how they are affected and steps to prevent the injuries that it could take. Again, not perfect, but it is a great brainstorming opportunity and helps you get started. And you can actually copy this and put it into Word or Google Docs or whatever you use. You can regenerate it if you don't like what it said. You can even have it read aloud if you want. So it has some pretty neat opportunities. And then because I'm at a children's hospital, I also asked it to write a script for a doctor to talk to a parent with young children about the findings of this research study and how they would impact them. And it did a pretty nice job. And we're a training hospital as well, so we work with a lot of students and medical residents and fellows. And this can be a great way to start thinking about the types of conversations that they can have and what you might want to share with your patients. And then I even went the next step and said, I'm just curious. One of the things the research paper talked about was changes that manufacturers can make. So I asked it to write a letter to a lawnmower manufacturer with suggestions of how they could modify the design of their lawnmowers to make them safer. And it even formats it in letter format for me. And it talks about the different things based on the research that it could do. And they're pretty good. It's a really good first start. Again, I would make the language my own. I would, modify it a little bit, but it's a great way to get started. This is just a quick example of many of the different types of things you can do. I'm going to stop at that point, and Katrina, maybe you can help me if there's questions that came up, or if anyone has any questions at this point, I can go in and we can ask it questions. We can do other things.
Sure. All right. Well, yeah, that was a ton of information. So thank you, Tracy. Again, Tracy is always bringing us, kind of what's new in the world. And so I know her work has helped me get more comfortable with this too. We did have at least one question here, and that is, so changes in output from day to day, is this related to updates, and what information is in the large language model?
So for the paid version, it doesn't learn as it goes. They have to do updates periodically. They are more frequent. The free version, it only updates every so often. The most recent version is only updated through content through 2023. So it's learning, but not quite how you think about it. When I talk about large language models, when you think about what they actually are, there's not a robot that kind of goes out and searches the internet for your questions. What it actually is a statistical model that predicts the next likely word. So no, in that the changes are the model just might be looking at different information in its training the next time you ask it. Little complicated, but it can help. Sometimes I'll do posts multiple or prompts multiple times just to see what it comes up with. But if you like something, you can see here, it'll save it if you have an account. So you can always go back to it later.
All right, Tracy, next question is, do you cite what you create with AI or ChatGPT?
So that is a fantastic question. And it is something that everyone needs to talk to their organization about. I try and cite whenever we do it, but there is a balance, right? If you've ever been to one of my talks, you'll see I often create images using ChatGPT for my presentation. And I always put a little code on there that says image created by whatever platform I use. Um, some institutions are doing that, some aren't. And it depends on how much I use, right? If I use it for brainstorming, but all of the words are my own, I and the thought process is more my own and I'm using it to just kind of check. I don't necessarily always do that, but I try to over disclose. Not everybody is doing that. I will say if you work with students or even other people in your organization, if your organization is not super clear about what their policies are, you should ask. We have found out recently that many of our students are using it and not disclosing that they're using it to us. So always, always, always have conversations about what your organization or even your team's policies are, and decide what that is for your institution. Great question.
And I'll just echo for anybody that's not checking the chat that there was a question about how we have access to this through our institution. And so I'll just verbal that our institution works with a lot of big data science, a lot of big data sets. And so AI is going to be incredibly important as we, examine genomes and look at these big data sets. And so we have access to it because obviously we're training on it, but we also do use it in our communications practice. We do think it is a useful tool. And so again, our institution does it, I think, primarily for the big data science aspect of it. But again, we find it useful for the communication side as well. So, next question, Tracy, is what do you think the impact of ChatGPT on the national patient education vendors? Do you think they will still be viable?
Yes, because I think of these as a tool to be used that can maybe help generate ideas or get you started. But the content that comes out is never, in my opinion, good enough to replace real humans and the work that they are doing. So I think it can make our work more efficient, help us with some of the like putting the letters in that letter format. That saves me a ton of time not having to go through and do all of that, but I still need to do the work myself. So I absolutely think that the vendors, the health literacy specialists, the writers, we need to still be there and it still needs to be our voice. Great question. Katrina, I also wanted to point out here really quickly. I switched over to the free version. Um, so Oops. Let me,
Oh, that was me. Sorry.
okay.
Almost at time. So
No, let me
I was
just
cutting you off.
really quickly put that back up here. The free version, whoever said that you can't generate images with the free version is right. It went back and said, I put the prompt in and the free version says I don't have the ability to generate images directly. So you can't do that in the free version of ChatGPT, but you could ask it for ideas. And many of you I know have Canva. So if you do that, you can ask it for ideas and then go over to Canva and you can actually do that. And I think Katrina's going to share that, how to do that next in our next training.
Yeah. And actually, Jamie has a note here that she, in her research or her organization, anything, if you use AI to assist with anything in publication, that is to be disclosed. So again, check your organization. It is something that will vary from thing to thing and is going to continue to change. And then one last thing, can you try to generate a table using ChatGPT? I think Chat Table still works. So the free version. While she's doing that real quick, I'm going to just verbalize Thank you all for coming. Again, we do try to keep these to 30 minutes. We're mindful of your time. Our next session is on August 22nd. And if you've registered for this session, you're actually registered for the next as well. And as Tracy mentioned, we're going to be going into the more advanced Canva design tools. So they've integrated some AI or even just some of their really helpful tools that we use kind of every day to kind of make our graphics and designs. One last note before she shares that, we do also have a next series after that on accessibility, and I will throw in information when I send out the video about that. So Tracy, one last thing.
Yep. So it can do tables, but as you see, it's a shorter version of the table. And in terms of publication, Jamie, thank you. Many journals actually do require you to disclose if you have used AI at all and what that looks like. So make sure you know that when you're submitting publications.
All right. Fabulous. Well, Tracy, thank you so much for sharing all of this incredible knowledge for us. Again, we really do hope that you all found this session incredibly useful. Again, I'll try to get this up quickly so you can review it. Again, I know there was a lot in there. So, again, thank you for attending and enjoy the rest of your Thursday. Thank you, everyone.
Thanks, everyone.
Looking for more HealthCom content? Check out all of our trainings and resources at cirtc.org.